So, Dr. Rohail, will you set the time for us, if possible? Or Dr. Helen, anyone of you?
Okay.
Okay, so 22 minutes, reminder at 9 minutes, 13 minutes, 19 minutes, then end. So, Dr. Nihad, you have 30 minutes with the patient and his mother. You have to take the detailed history. I'm just reading the referral letter from the GP. Okay, the role is you are a specialist training, outpatient department. You are talking to Mrs. Oliver and her 9-year-old daughter, Millie. So you have referral letter, dear doctor, referring Millie Oliver. Thank you for seeing Millie, who is 9 years old and has complained of central abdominal pain on and off for the last 4 months. Her attacks are painful and she has been sent home from school on numerous occasions. Her brother Saul has constipation and I saw him 2 weeks ago. Mrs. Oliver says that she has no concerns about Millie's bowel habits, but is concerned at the amount of school she is missing. Examination today was normal, although an organic cause is unlikely. I would be grateful if you could assess her to see if this needs investigation further. Yours sincerely, Dr. Lino Cohn, General Practitioner. Okay, so you have a mother and her daughter, 9 years, Millie, with the background as I read it in the referral. So you have to take the detailed history from the patient and her mother.
Okay, start.
Do you need 1 minute or 2 minutes to prepare?
It's fine, I can start. Hello, good morning.
Good morning.
I'm Dr. Ibrahim, one of the children doctor. I believe I'm talking to Mrs. Oliver, mother of Millie.
Yes, doctor, I am.
Nice to meet you.
Thank you, doctor. Same here.
Actually, today I am here to take and to ask you some question and to take some notes about Millie condition. All right?
Yes, doctor. Sure, no problem.
Okay. First, Miss Oliver, tell me what happened with Millie.
Yes, Dr. Millie is suffering since last 4 months, and she is suffering too much with pain in her belly, and sometimes it is too much pain. She cannot tolerate even. We went to the doctor multiple times, and they're not doing any investigation. They are saying she's fine. But recently it is increasing, and also she missed a lot of school because of her pain.
Yeah, I can understand your concern. Could you please describe me this abdominal pain?
Yes, this pain is like it's coming and going without any reason, and which usually there for maybe around 20 minutes, sometimes 25 minutes, sometimes even 2 hours. So I gave her like a painkiller, like some tablets for the pain. It helps it little, but it's come, and there is no any cause why it comes.
Okay, I'm sorry for that. When did pain start, Mr. Oliver?
Yes, it has been around 4 months, doctor.
Okay, is it confined to a special area? Specific area, I mean?
Yes, usually it is near the belly button.
Okay. You tell me that this pain is becoming better by giving some analgesic, yeah? Do you observe anything that cause increase this pain?
No, doctor, but I don't feel that it's any relation with that increasing pain. Sometimes it comes early morning, sometimes at night, sometimes in morning time.
Okay. If your child feels sick during this pain or after.
Yes, during that pain, sometimes I feel that she is going to be pale in color.
Belly color. Okay. Any vomiting? I mean,
No,
stool.
no vomiting.
Okay. What about
No.
his bowel habit, Miss Oliver?
No, doctor is quite fine. She usually used to go 2 times or sometimes 1 time in a day, and she did not
Uh-huh.
complain even.
Yeah. Sometimes child go to the bathroom and to make poo, and again he feels that he is not evacuated well, and again he will retain. Did you observe that in your child?
Yes, usually I observe because it has been 4 months, but I don't feel that any of the problems she has in her poop.
Okay. Uh, is there any fever, an increase in temperature?
No, doctor.
Uh-huh. What about his appetite? Is he eating well?
Yes, her appetite is sometimes you can say she's a little bit picky eater, but usually she's eating at every time she eats.
Did you observe any weight loss?
No, doctor.
Yeah, his growth is fine to you.
Yes.
Okay. What there is any headache, Miss Oliver?
No, doctor. She did not complain.
Okay. What about his bee? Any pain during maturation?
No, it's
Okay.
normal.
Did you observe any cough or he complained from any cough?
Any?
Any cough
Sorry.
or shortness of breath?
No, no, doctor. She's fine.
Okay. What about his joint? Did you observe any joint swelling or joint pain?
No, doctor. She's even playing well at home. Or school, I don't know, but she's okay.
Okay, that's good. Do you observe any skin rash? I mean, any
No, doctor.
discoloration on the skin? Okay, fine.
No.
Um, is he allergic to any food?
So once I remember when she was child, she had an allergy while she was eating some nuts. After that, she became fine when she became a little older.
Okay. Did he has interest in special type of food, or he's eating regular as the family?
No, definitely at this age, everyone likes to eat fast food, but once in a week, she's
Okay.
eating fast food.
Okay, I can understand. What about drugs? Is any medication now he's taking?
And no, but whenever she feels pain, so I am giving her some pills for the pain.
Okay. What about the vaccination? You give him all the jab?
Yes, it is on
Okay, fine.
hepatitis.
Uh, you told me that there is some school problem. Can you explore this for me more?
Yes, doctor. Actually, initially she was missing 1 or 2 times in a month school. So I was thinking it's okay, but it is increasing. Even last 1 month you can or 2 months you can say she missed her school because of this problem 2 weeks. I'm worried about her studies.
Yeah, I can understand your worries. Uh, he like his school, or
Yes, she was good and she likes to go to school initially before there was no any concern, but nowadays she is refusing to go because of the pain maybe.
what about relation between her and her peers in school?
What I know that she is a shy girl. She feels shy from the others.
Uh-huh. Okay. Did her school nurse know that she has some problem? Did you inform her?
No, whenever she comes during school, she has a pain and they send her back. So at that time, she knows actually.
What about playing? Did she play with others, or or this pain
She
affected her?
used to play, doctor. She used to play with her. She has a friends, but she is actually fighting too much with her friends on minor things.
Okay, the sensitive gap.
Yeah.
Okay. Uh, what about this? I mean, family history, or there is anyone in the family have this condition?
No, doctor, there is no any, but my another child, and he has some constipation.
Mhm. Yeah,
That's it.
yes. Uh, sometimes there is some disease like irritable bowel syndrome or celiac disease, if you hear about it before. Anyone in the family have this problem?
Yes, doctor, I'm worried about it because one of her aunt, she's suffering from Crohn's disease for
Uh-huh.
4 years, and she's in trouble. So I'm actually worried about it, and
Nine
no
minutes
one has
done.
did the test.
Only
Okay,
four
thank you.
minutes remaining.
Okay. I'm sorry for that. Um, okay. Is your husband is your relative? There is any relation?
No, doctor.
No. Okay. I want to ask you about any past history in the past. She's suffering from this abdominal pain in the past.
No, doctor, not abdominal. Sometimes she had like upper respiratory infection, like fever and cold and past when she was very young.
Okay. Any history of surgical operation in the tummy or any other surgical operation?
She had a fracture of the middle finger, and at that time she got an just plaster when she was 3 years old.
Okay. Tell me, Miss Oliver, what is your biggest worry now?
Doctor, first of all, I want to know that you should do some test for her to know that either she's suffering from maybe Crohn's disease. I'm worried about because her aunt is suffering. The second thing, she missed school a lot of. It's a big loss for me that she's not going for a school. I don't know how to cover the remaining work of the school for her.
Yes, I can understand your worries. And actually, we are here to help you and Millie. We are going to do extensive investigation for her to know,
Thank you,
um,
doctor.
to exclude any organic cause, and we will deal with this school absence. Uh, Thank you, Ms. Oliver, for your time.
Thank you, doctor. Okay, so what's the time here?
Still, I think 2 and 2.5 minutes. I think so.
2.5 minutes remaining. 2 minutes 20 seconds remaining.
I think I missed too many
So,
things. I
okay.
still.
So this 2 minutes you have to keep quiet in the exam room because you finish early. The examiner will not ask you anything, right? Okay. Now we start from the 13 minutes, Doctor. Please. Okay.
Mhm.
So yes, doctor, please summarize this case for me.
Okay, today I took a history from Oliver. Today I took a history from Oliver mother, from Millie mother. Millie is the 9 years old boy, presented complaining of central abdominal pain, occurring about 2 minutes, 20 minutes per day, uh, relieving by giving analgesics. Um, this pain caused school absence, and this is the biggest concern of the mother. There is a family, also there is a family history of Crohn disease in her aunts, Millie aunts. Uh, there is no other organic symptoms or there is no other red flags in the history.
Okay, doctor, what is the biggest worry of the mother?
What? I didn't hear you.
What is the biggest concern of the mother?
The biggest concern of the mother is the school absence, and she afraid that maybe her baby has Crohn's disease, as there is a family history of Crohn's disease
So,
in her
what
mother's side.
advice you will give her about her concern?
First, we will do an examination, then we will request an investigation to exclude any organic cause. First, I will do a CBC, then I will do inflammatory markers, urine microscopy, and urine calcium sensitivity. Also, I will request for a stool culture. I will make a celiac screening, and I will do an ultrasound to exclude this Crohn's disease.
Okay, when will you refer this child to any other specialty?
To me, this child now there is no obvious red flag. So after making sure investigation are normal, we can no need for referral.
Okay, as you said, there is no red flag. So, what could be the red flags in this case?
The red flags, if this abdominal pain is not is away from the umbilicus, or there is vomiting, if there is blood in the stool, if there
Have
is
you
any
asked the
concern.
history of blood in the stool?
No, actually, I forget.
Okay. Okay. What are the red flags?
Weight loss and any filtering on growth.
Okay.
Okay.
Anything else? Have you asked the history that child is waking up from the sleep because of the pain?
Yes, actually, this is an important point I forgot to ask. Sorry.
So is
Yes,
it a red flag?
waking from sleep is a red flag. Yes, it's
Okay.
a red flag. Yes.
Okay. Right. So you said it is not the organic cause. So how can you rule out it's not organic cause from history?
From the history, by the absence of red flags, and also if the investigation were normal, if all these are normal, we will exclude the organic cause. And also the nature of the pain, central abdominal pain, confined to the umbilical area with no radiation and with no any association.
Have you asked the dietary history?
I ask about any food allergies and what type of food baby likes, the child likes.
Okay. 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 So, okay, for example, you did the investigation and all investigations are normal. Okay.
Yeah, I will
So,
reassure.
mhm.
If all investigation are normal, I will reassure the parents, and I can prescribe simple analgesic to help the baby, and I will encourage the baby to go back to school, and I can take permission from the parent to explore this issue with the school nurse or at school.
Okay, so if you examine the baby, you took the history, you are thinking it's not an organic cause. What the investigation you will do?
Again, please.
If you took a history and on examination, there you couldn't find any organic cause. and you find it's a recurrent abdominal pain or functional abdominal pain, what investigation will you do?
Actually, no need for more investigation.
Good. Okay.
Just we have to reassure the parents. I have to reassure the parents.
Will you do urine analysis at least?
What?
Will you do urine analysis at least?
Yes, we can do urine analysis.
Okay. What is the definition of recurrent abdominal pain?
Recurrent abdominal pain. This abdominal pain happen more than 2 times in 3 months with no association like vomiting, blood in stool, uh, with no red flags. I mean,
Okay. So what about the functional abdominal pain?
functional abdominal pain. This abdominal pain confined to the umbilical area with no radiation and with no vomiting, with no fever, with no loss of weight.
There's no any pathological condition, right?
Yes.
Okay. So if you are saying it's a recurrent abdominal pain or functional abdominal pain, how would you address the mother?
Mm, I will reassure the
Your
mother.
strategy,
Yeah,
your strategy has not worked. So you reassured the mother, but still mother says the problem is the school and her behavior. Like as in the history, you got that she is fighting with her peer on the minor things, right?
Okay, yes. I can refer the patient to the child and adolescent mental health for more support to the mother. Also, we can refer her to the psychologist for this. If still, we can consult the pediatric pain team to deal with with this abdominal pain.
Okay. Have you asked the history of yellow discoloration of the eyes, jaundice?
No, I
Is
forgot.
there any significance in the abdominal pain?
Uh, yes, jaundice.
Have you
Jaundice.
asked the birth history?
I didn't ask, but history of jaundice is important. Maybe this is an يعني I mean, hepatitis can cause abdominal pain and can cause yellow discoloration of the sclera. So
What about the socio-economic status of the family?
yes, I forgot to ask.
Okay, so what about the relation of the peer, like in the siblings with Millie? Is there any problem in the relationship with her parents and in between Millie and siblings?
Yeah, yeah, this is an important point. Also, I forgot to ask.
Okay, so anything else which you forgot?
I don't know.
Okay, so if there is a relative with the
Time's
Crohn's
finished.
disease, time finished, alhamdulillah. No more questions.
Finally, finally. Where are you?
Alhamdulillah.
Grilled. Grilled.
Dangerous time, difficult time. So, anyways, Dr. Nehal, you were good in the history, but you missed the things that I will explore. I'm not telling you what you did the good. You know that you did the good, but things which you missed, the main thing that you finished early, 2 minutes and 30 seconds, right? And after that, in the history, initially, from if there you start the pain, you are not asking all abdominal pain associated symptoms and simultaneously together, like any history of blood in the stool, hard inconsistency. I think you asked about the hard inconsistency. Or no, I don't know. You asked only constipation.
Yes,
But
I
you have
asked her.
to ask the hard and consider if is she feeling pain when she passed the S2. But you only ask either she's having evacuation problem or not, right? So you have to ask about the blood in the stool and any hard, any feeling of pain when she is having passing the stool. So you ask about the pee, that's okay. You asked about the cough and other things, but you did not ask about the jaundice, which is also
Yes,
important in abdominal pain.
yes,
And you did not ask about red flags. Red flags are very important. You have to ask all red flags, like you missed the things waking up from the sleep, pain, and other thing in the red flag is blood in the stool. These two red flags you should have to address. This is very important in all history which is having internal pain. And vomiting, there was no vomiting, but if there is vomiting, you can ask about the BS vomiting, color of the vomiting, right? And other thing when I ask you about the investigation is there is recurrent abdominal pain or functional abdominal pain. Investigation urinalysis is the must. If it is normal, no need for other investigation. But we should rule out if there is any concern of the condition like irritable bowel syndrome or celiac or peptic ulcer disease. So also you did not ask about peptic ulcers and silent symptoms like burning sensation, like fullness of the tummy after eating, and these things I think we should ask as well. The otherwise social history was totally lacking, and you should address the psychological symptoms as mother told you that she is a little bit anxious and fighting with the peers, so that you should social history is important in this case. The other thing was okay. So anyone else has the feedback?
Dr. Wakar, I missed in between. I just wanted to ask you what was the reason for the pain here?
It was a non-organic pain. We can say recurrent or functional abdominal pain.
But did you give any signposting, like towards any particular
Like
reason?
no reason, it's functional. So she is missing a school. She has problem with the peer group at the school, psychological issues, and so this is the only reason of her functional pain.
Okay.
Dr. Wakar and Dr.
Mhm.
Nihad. Dr. Nihad's history was quite very pleasantly. She was taking the history, and she used lot of jargons
Mhm.
like shortness of breath
Vomiting.
and some two, three more. She used
Yes. Okay.
jargons. I forget two, three more. See, usually, if you use, then you can explain the parents, patient like difficulty in breathing. And secondly, regarding the investigation, you should do the baseline investigation in order to rule out anything any which will help in the diagnosis.
But in
Baseline
guideline, it
invest
is not saying.
sorry,
In
guidelines say
guideline,
no.
it is
Uh,
written. If it is
uh,
written, if there is no in the history and examination, you couldn't find any organic cause. All it is normal. Then you do the urine analysis,
but
but other test no need. If you find any kind of
yeah,
symptoms, then you
yeah,
should go for it. But referral is important in this case. Any chronic abdominal pain should be referred to the GI doctor, gastroenterologist.
okay.
Just tell me
And
something, Dr. Kar.
sec
Here is first degree relative is positive for Crohn
yeah, that's
disease.
I'm coming on this
Not
point,
first
no?
degree. Aunt is not first degree. So first degree means
Uh,
parents are a
Parents.
sibling.
But anyway, I don't know, but this Mark Beatty written, he wrote that there is a basic investigation done so that we should be sure the thing is wrong. Then needs to counsel the
Yeah,
parents and send. After that, we have through counseling the parents, patient for the daily recording of daily pain and association, and she will come up again to your clinic in a 2 weeks time, 1 week time, according to the pain. So that time she will tell what thing has done and how she managed and what were the problems. And then, as she told, pain management team and talking this one, CBT, this thing required. I want to ask you, when we are talking about pain, who should say this pain is worsening or not, or same like before? And frequency, need to ask. If it is frequent than before, if it is quite frequent, then we should take it seriously. If it is frequent,
No, because mother told since last 2 months it is more, and she lost her school 2 weeks around.
yeah. So what?
So,
How you will
so it
take this?
means
If the pain is frequent and worsening,
hmm,
and it means it will be any disturbing her
if there
daily
is no
activity.
any no any cause like no any associated symptoms like cough, like constipation, like vomiting, and like the problem in the growth, no any red flag, fever, stool, blood in stool, not waking up at night. Then after this and after normal examination, no hepatosplenomegaly, no jaundice, all history is
Right,
normal, past
right.
history is normal.
Mm-hmm.
Then better not to go for any of investigation. The only thing is, even though you have to refer the patient to the gastroenterologist, but you have to do the urinalysis. But if you
Yeah,
find anything like vomiting, like fever, like other thing,
yeah.
loss of
These
weight,
are
any
red
red
flag
flag,
sign.
you
Yeah,
have
these
to
are.
do. Yeah, you have to do
Yeah,
all
then
investigation as Dr.
then we
Niyaz
cannot
has mentioned.
ignore.
Yeah.
Mm-hmm.
So it's
And
careful
whatever
history actually. Focused
is.
means you have to mention this red flag important.
Uh-huh.
Okay. So the red flag here, it is very young child and pain localized out from the umbilicus and vomiting, especially bilious, unexplained fever, change in bowel habits like diarrhea, blood in stool, or nocturnal awakening with the pain, weight loss, poor growth, and family history of celiac, inflammatory bowel, or any peptic ulcer. So
Okay.
these are the red flags. These we have to mention in all abdominal pain history.
What are, can you repeat again, Dr. Bakar, please?
Yes, chronic abdominal pain, the warning signs are very young child, pain
Okay.
localized, pain well localized, and which is out from the umbilicus, not around the umbilicus.
Okay.
And vomiting, especially if it is bilious vomiting, we all know, and
Hmm.
unexplained fever, and change in bowel habit like a diarrhea, blood in stool, or constipation, nocturnal waking with the pain, weight loss, poor growth, first degree relative with celiac or inflammatory bowel disease.
Okay.
So anyone else has a comment on this scenario? So Dr. Nehad, you need a little bit more in the history, and inshallah by time we will see.
Yes,
But
actually,
you're
since I didn't practice,
confident.
maybe more than
This is
that is why I forgot too many
yeah,
things.
we have to do practice.
Yeah,
But
I
your
just
confidence level and asking way was good.
okay.
Anyway, so see you guys tomorrow, inshallah, in afternoon time. So I will post in the group about that.
Okay.
Okay.
Dr. Wakar, Dr. Wakar,
Yes, Dr. Irfan.
uh, what is our days? Usually I'm confused. I forget. Monday or Sunday, Monday, and Saturday like that.
There are no
What
fixed
is?
days, as I mentioned earlier, no fixed days because my roster is coming weekly, schedule of duty schedule.
Oh,
So I
okay, okay,
go,
okay. That's why I was confused.
no, not fixed. I have
Oh, okay,
shift duties like sometime and weekly roster they are making, not the even monthly.
okay, no problem. That's okay.
So I can even
Helpful.
cannot put the monthly.
Yeah,
Inshallah.
yeah, yeah. Yeah, inshallah, from onward, I will be active and
आपकी
vigilant,
जर्नी कैसी
inshallah.
रही? आपकी जर्नी कैसी
Alhamdulillah.
रही? क्या था माहौल?
For
Alhamdulillah,
for
Alhamdulillah. It was smooth.